Hey there, my name is Christie Zink, and many of you know me because I am an advocate for those who are affected by a rare genetic connective tissue disorder called epidermolysis bullosa, or EB. And for those of you who are unaware of EB, EB is a condition in which those who are affected lack the proteins that basically anchor their skin. And what that means is their skin is extremely fragile. So everyday things such as even just a simple hug can cause excruciatingly painful blisters or wounds. These wounds are unfortunately extremely susceptible to infection, and these infections can sometimes prove to be lethal. Due to this, they do everything they can to protect themselves from wounds and infections, and they do this by using specialized bandage products that do not adhere to their skin. You would often see someone with EB wrapped from head to toe. The bandages require to be changed relatively frequently, and affected persons need to be bathed in either bleach or vinegar to kill bacteria. It's oftentimes a very tedious and painful process. However, because there is no cure for EB, the wound care is really the only effective form of treatment at this point. And the challenges of EB extend far beyond wound care. No amount of care can stop the wounds from coming. And with chronic wounds come chronic scarring. And this chronic scarring can often lead to deformities of the hands and feet. And unfortunately, it also can lead to skin cancer, which in many cases is fatal. People who are affected by EB need a cure. They're waiting patiently for doctors to make progress, to give them hope at a chance for a better life, a life without pain, a life without bandages. Unfortunately, EB lacks the national focus that many other disorders have, and that means that they don't get the same amount of funding as other disorders. And so people are forced to continue to wait and wait. And while they wait, they suffer and sometimes die. We can help by helping doctors like Dr. Jakub Tolar at the University of Minnesota and his team. They are working so hard at trying to find a cure, but they need funding. They need people like you and me. So I challenge you and I urge you to help educate others and to make a donation. You can visit irefuseeb.org and click on the donate tab, and 100% of your donation will be donated to the University of Minnesota, Dr. Tolar and his team, and it will help them progress their research for a cure for EB. It's up to you and me to help stop EB.